Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious diseases, hepatology, and gastroenterology. Our topic today about erysipelas treatment. So also we will discuss what about causes of erysipelas, symptoms of erysipelas, also diagnosis and the treatment of erysipelas. Also we will discuss prevention and the outlook of erysipelas. Erysipelas is a skin infection. It is a form of cellulitis, but unlike cellulitis, which affects deeper tissues, erysipelas only affects the upper layer of skin. However, the two conditions can overlap, which can make it hard for a doctor to tell the two conditions apart. Previously, doctors thought that erysipelas only affected the face, but the National Organization for Rare Disorders now estimates that around 80% of cases occur in the legs. It can also appear on the arm and torso. What about symptoms of erysipelas? Often a person will feel unwell before visible signs of erysipelas appear on the skin. Symptoms can include fevers, chills, shivering, and high temperatures. As regards the skin is then usually affected in a particular area and can appear in one of the following ways: swollen and shiny, redness, warm and tender cases, sharp edges between the affected area and the unaffected skin. Also sometimes red streaks above the affected area. Also it can turn purple or black in severe cases. These signs and symptoms are often quite abrupt and can develop in just few hours or days. What about causes? Erysipelas develops when a bacteria enters the skin through cuts or sores. Skin injuries that increase in the chances of developing erysipelas include cuts to the skin, ulcers or bed sores, insect or animal bites, wounds from surgery, a pre-existing skin conditions that break the surface of the skin also increase the chances of getting erysipelas. These conditions include eczema, impetigo, fungal infections such as Cellulitis foot. Other conditions can also increase the likelihood of a person getting erysipelas. These do not always affect the skin directly and includes veins and lymphatic vessels not working as they should. Also obesity, alcoholism, poorly controlled diabetes, circulation problems, weakened immunity. Some medication can weaken the immune system and lead to erysipelas. This medication include some cancer drugs and the medication commonly used after organ transplantation. Anyone can get erysipelas, but it is most commonly affects infants and adults over age of 60. Erysipelas is not hereditary or contagious. How we can diagnose erysipelas? So, in general, a doctor will be able to diagnose erysipelas by the appearance and the symptoms of the affected area. This is because the symptoms of erysipelas tend to occur only with this particular condition. The person's medical history, highlighting previous injuries or surgery, will often suggest the possible cause as well. Further testing is not usually needed. Doctors may carry out blood tests if there are any signs of systemic infection, such as a bacteria in the blood, like bacteremia. However, the identification of bacteria is not always possible, even in a laboratory. Tests can also help to reveal raised levels of white blood cells, which can be caused by tissue damage and bacterial infection. Also, sometimes we see elevated levels of C-reactive protein, which is produced by the liver uh, in increased amount when inflammation occurs. Sometimes positive blood culture indicating a bacterial infection. Also, the presence of a specific infection caused by animal bites, for an example. In some cases of deep infection, MRI or CT scan is necessary. So, what about the treatment and the recovery? Erysipelas is a curable disease. It is important to start the treatment as early as possible to limit the chance of further complications. Antibiotics treat erysipelas, so the exact type will depend on what germ is causing the problem, but it will often contain penicillin. It is therefore essential that anyone who is allergic to penicillin tell their doctor before starting treatment, so that they can prescribe other medications such as erythromycin or cefalexin. People with erysipelas will typically take antibiotics by mouth for between 7 and 14 days. In more severe cases, the drugs will be put directly into the skin via a drip. There are also other ways to help relieve pain and discomfort and speeds up the healing process, such as keeping the infected area elevated, also still ensuring movement to try and prevent clotting, cooling packs placed on the skin, lotions to stop the skin getting dry and cracking, anti-inflammatory painkillers such as ibuprofen, compression stocking once the infection has settled. Treatment for any breaks in the skin often with prescribed cream that is applied directly. So all this lead to recover rapidly. So as regards the prevention, uh, we can know that signs of fever and illness associated with erysipelas will often disappear within few days of starting treatment. Although the skin infection can take weeks to clear up, there is no scarring. But one-third of those who receive treatment for erysipelas develop the condition again. When this happens, a long-term course of medication can be prescribed to treat it. It is important that the person sees their doctor as early as possible if they have any concerns about repeat attacks. Thank you very much.